If your medication is refrigerated, remove as instructed prior to infusing. Clean your work area. Wash your hands thoroughly for at least 20 seconds. Gather your supplies and equipment. You will need medication vials or prefilled syringes, Avoset pump, Avoset tubing set, Sub-Q needle set, Sharps container, 50 cc syringes for medication if indicated, Y-site if indicated, mini transfer spike if indicated, 1 for each vial, ChloroPrep swab sticks, alcohol swabs, treatment diary, emergency medication kit, and batteries for your pump if changing your batteries. Check label for name, drug, frequency, and expiration. Inspect the medication for any cracks, leaks, particulate matter, and clarity of medication. Repeat for each vial and contact Chartwell for any discrepancies or concerns. Remove the Avoset tubing from the package. Prepare your medication for administration according to your plan of treatment. If your medication is in a vial, remove the protective covers from each vial. Using a new alcohol wipe for each vial, wipe the top of each vial with the alcohol wipe and allow to dry. If your medication is provided in a syringe, ensure you have all syringes to total your prescribed dose. Using caution not to touch the spike, place a mini transfer spike into each vial. Draw up the IgG from each vial into the provided syringes by attaching the syringe to the mini transfer spike and hold the syringe upright. The vial will be upside down. Ensure that the total volume of IgG in the syringe is the dose you are prescribed. Whether you are using a syringe and vial or prefilled syringe, please be sure to remove all air from the syringes. Note, depending on your therapy, you may need to use this Y-site when using more than one syringe. If using the Y-site, attach the Y-site to the Avoset tubing and then attach each syringe to the one end of the Y. If you're only using one syringe, you will attach the syringe to the Avoset tubing. You will attach the needle set to the other end of the tubing. Prime the tubing by holding the syringe upright with the plunger on your workspace. You will apply pressure to the plunger to prime the tubing. If you have two syringes, apply equal pressure to both plungers to prime both sides of the Y-site. Leave 1 to 2 inches of air at the end of the tubing by the needles. Do not prime the needles. Remove the white anti-free flow valve release clip from the tubing. Turn the pump on by pressing the on-off button. Position the cassette at the bottom of the pump with the syringe on the right side. The flow direction arrow points left relative to the pump front. Push the cassette into the pump's cassette socket. You should hear 2 clicks to indicate the cassette is fully latched. Verify it is fully latched. Press Review, and then press Next on the screen. Once you have reviewed all parameters, press Done. Choose your appropriate subQ site. Avoid insertion sites with bony prominences and areas that are scarred, inflamed, or infected. Appropriate insertion sites include abdomen, deltoid, upper buttocks, lateral thigh, or lateral hip. Select a new site with each needle placement. When using multiple sites, needle placement should be at least 2 inches apart, 2 inches from the umbilicus, and 1 inch away from previous insertion sites. Cleanse the site with ChlorPrep or alcohol if you have a chlorhexidine allergy. You will use a back and forth friction scrub for at least 30 seconds and let it air dry for 60 seconds. Allow the site to dry thoroughly and do not blot it dry. Carefully remove the protective cover from the subQ needle, keeping the exposed needle sterile. At the needle insertion site, pinch the skin and insert the subQ needle at a 90-degree angle. Check placement if indicated in the manufacturer's package insert or as instructed by your nurse. Apply clear dressing over the needle insertion sites. You can secure any excess tubing to the skin using adhesive tape. Make sure all clamps on the administration set tubing are open and press the Start Pause button to start the infusion. The infusion delivery will begin. When your infusion has completed, an alarm will sound and you will see the message display Infusion Complete. Press Mute, then Dismiss to clear the alarm. Change bag or turn off infusion will display on your screen. Hold the on-off button for 3 seconds to turn the pump off. Clamp the tubing and leave the needles in the skin for an additional 5 minutes to permit absorption. At this time, you can fill out your treatment diary. Peel off your label with the product, lot number, and expiration and affix to the treatment diary. Release the tubing from the Avoset pump. After washing your hands, gently remove the transparent dressing while securing the subQ needle. Remove the needle by pulling straight out. You will leave the syringe attached to the tubing and discard the used syringe and tubing and needle in the sharps container and place a Band-Aid over your insertion sites. Dispose of any IgG that is left over in the vial in the sharps container, and at the end, wash your hands thoroughly for at least 20 seconds.